State health leaders say that we are far surpassed their previous peak in COVID cases from the winter months and holiday season, and it's going to continue. During the weekly press conference today, Dr. Thomas Dobbs recognized the rise of vaccinations, but says it's not enough. 12 News' Anna Ferris listened in on that discussion and joins us now with more on their plea. Anna?
Dr. Thomas Dobbs continued to plead a case for COVID-19 vaccinations. He says at this point, there's really only two options for folks. Either they get vaccinated or monoclonal antibody testing to help save their life. State Health Officer Dr. Thomas Dobbs says the numbers speak for themselves. 98% of COVID cases, 89% of hospitalizations, and 86% of deaths have appeared in people unvaccinated.
We are clearly at the worst part of the pandemic that we've seen throughout, and it's continuing to worsen. We're seeing higher and higher numbers, not only of cases, but also hospitalizations, people in the intensive care unit, life support, and then, like we've seen before, sadly, additional deaths are going to follow.
Since the start of the pandemic, almost 8,000 Mississippians have died, many of those older adults. Now, with the Delta variant surge, the younger population is feeling the impact.
When you look at it a little bit more detailed, you can see that a large part of the growth is in children aged 6 to 10. Now, the more cases that we see in children in this age group, unfortunately, this will translate to potentially more hospitalizations of children under the age of 18. And unfortunately, we may see additional deaths, but we hope that we don't.
Dr. Paul Byers showed how quickly the virus is spreading in schools. Both he and Dr. Dobbs agreed mask mandates and vaccinations are the only way to prevent the spread and keep the child mortality rate from climbing.
The more that we ramp up cases, these tragedies are going to multiply. It's just going to happen very sadly. Most kids will get over it just fine. Only about 5% of kids have long COVID. But if it's your kid, it's 100% tragedy for you and your family. But we will see more because we're seeing continuing increasing numbers. We don't have any anticipation that the number of cases in children is going to decline anytime soon.
I don't think that it's going to be really a one piece that you can hang on to that's going to limit transmission in the school settings. I think it needs to really be all of the recommendations, and certainly vaccination and universal masking, regardless of vaccination status, is going to be important. And an additional layer is the asymptomatic screening testing to be able to identify those individuals who may not be showing any symptoms but are infected and can transmit it so that we can get them excluded from the school setting.
Dr. Paul Byers says over 70 schools have agreed to vaccination programs to come on site and administer shots to eligible students. 29 schools have signed up for on-campus COVID testing. State health leaders say the Delta variant isn't something to take lightly. The only way to put an end to it is getting vaccinated, monoclonal antibody testing, masking up, and social distancing. For 12 News, I'm Anna Ferris.